everyone. We're here with Matt Meador, the Chamber of Commerce President and CEO of Southwest Indiana. We're here in Evansville, Indiana today on the Campaign for Responsible Healthcare Reform Tour. It's our first stop in Indiana, and Matt, we're talking to small business leaders around the state and Hoosiers, everyday Hoosiers, about the healthcare legislation and their feelings on it. Can you give us an idea of what small business owners in Evansville are talking about as it relates to healthcare reform?
Sure. Well, small business owners are concerned. They're concerned regarding access to health care. They're concerned about cost. They're looking at the current proposal that Congress is considering, and they're asking themselves, why is Congress not looking at tort reform? Why is Congress not looking at digitization of all medical records? Why are they looking at ways to pay for this bill that might be detrimental to the small business community and detrimental to individuals who might be willing to take a risk to start a small business at some point in time? There are a lot of questions, and I think generally speaking, the business community has a lot of concerns about the bill in its current iteration and probably would like for Congress to take a hard look at the bill and maybe build some of these other issues into consideration. I think there's also concern on the part of the small business community that what's being proposed is a bit disingenuous because they're talking about, this thing is essentially supposedly going to be budget neutral over 10 years. But you start collecting the dollars in 2010, you don't start spending the dollars until 4 years later. And so, what about after the first 10-year period? It doesn't seem to the small business community that this proposal in its current form truly is budget neutral. So there are a lot of concerns that the small business community has related to healthcare reform.
Let's talk about job creation. We're in the middle of a recession. We're trying to recover. There's concern that this legislation raises significant taxes and fees on the business community. Given your conversations with business owners here in Evansville and all over Southwest Indiana, what do you think they would say about legislation that raises taxes and fees on them as it relates to their ability to create jobs?
Well, the small business community is essentially going to say, look, if you add a lot of additional taxes or a lot of additional fees onto us as small business owners, it's going to create an environment where we're going to have a disincentive to hire additional individuals into our businesses. It's going to put a drag on our ability to be profitable and to expand our operations. So I think they see it as being a real problem. And I think we all should be concerned about the impact that these fees and additional taxes might have on our economy down the road and job creation. And it's just a bad time to be looking at anything right now that could potentially prohibit or put a drag on the creation of new jobs, particularly when unemployment is nationally is 10%. In the state of Indiana, it's knocking on the door 10%. Policies like this just don't make sense right now. There's a way to do it. I don't think there's any question that broadly there needs to be health care reform. But the way that it's being considered right now is very problematic. And probably the biggest problem is having a program that's administered by the federal government. I just cannot understand why anyone could believe that a program that's administered by the federal government would be more efficiently delivered, more cost-effectively delivered than a program being delivered by the private sector. So the small business community is really wringing its hands over this piece of legislation. From our perspective, Congress really needs to take a step back and slow the debate down and come up with, frankly, a more thoughtful bill.
Matt Meador, President and CEO of the Chamber of Commerce of Southwest Indiana. We're in Evansville, Indiana on the Campaign for Responsible Healthcare Reform.